from Alabama, Ms. Sewell. Right for 5 minutes.
Mr. Speaker, I rise to speak on the Affordable Care Act and the Trump administration's efforts to repeal the health care of millions of Americans. Every person in this body has constituents who have health insurance because of the Affordable Care Act. Whether you represent the rural community in Kentucky, where the uninsured rate declined 60% under the ACA, or you represent the most liberal district in the country, you should be committed to working across the aisle to fix what is wrong with the ACA and build upon what's working. While the law and President Obama may not be popular in many districts, political expediency has no place in this hallowed body, especially when the economy and American lives are at stake. It is not just Democratic districts who benefit from the ACA. Everyone has Americans in their districts that benefit from the ACA. While I am the only Democrat, my district has only the 5th highest population of enrollees in Alabama, behind 4 Republican districts. Alabama's 1st congressional district has over 29,000 enrollees, and the 5th district has 25,000 enrollees. The 6th and 4th districts of Alabama both have over 23,000 enrollees. My district has 22,000 people who are enrolled in the ACA. In total, there are 165,000 Alabamians who have coverage through the health care marketplace, and over 20 million nationwide. There are many who benefit in Alabama and across this nation from the ACA. And while we all benefit from not having to have pre-existing conditions be a deterrent to getting health care, all of us will not benefit from the repeal. In fact, it should not surprise many of us that the repeal of the ACA will benefit the wealthiest Americans. According to the Center on Budget and Policy Priorities, ACA repeal will lavish Medicare tax cuts on our nation's 400 highest income households, while 7 million low and moderate income households will lose premium tax credits. The average annual income of those top 400 families is $300 million apiece, and they will benefit from an average annual tax cut of approximately $7 million apiece. What my Republican colleagues do not want Americans to know is that the repeal of the ACA will not benefit the majority of the Americans, but rather only the rich. An average income of $300 million is more than 6 times the average household income in Alabama and nearly 900,000 times, the average household in my district. Mr. Speaker, 99.9% of my constituents make income below $200,000. I know that they will never see the breaks that the repeal of the Affordable Care Act will give to the wealthy. While health care costs have been growing nationwide at the slowest rate in over 50 years under the ACA, we cannot ignore the hardworking Americans who are facing outrageous premium hikes in states that have not expanded Medicaid, like Alabama. On average, states that have been hostile to the law are facing the largest premium increases for 2017. One study showed that states that fully embrace the ACA will see increases of 18.2%, as opposed to states that have fully resisted the law, like Alabama, which have shown increases in premium of 29.8%. Mr. Speaker, it is unacceptable to Americans that we have this rise in premiums at any level. But my point is simply this. We should not be looking to repeal the Affordable Care Act without replacing it with something. Because the fact of the matter is, in this great country that we live in, no one should not have access to affordable quality health care. Alabamians enrolled in employer-based health care insurance are paying more in their employee contributions than those in California, even though Californians have a significantly higher cost of living. This is one of the reasons why I have worked across the aisle to try to make meaningful changes to the ACA that don't compromise the law's benefit. The American people deserve representatives that will work together to fix what is wrong with the ACA and build upon what is working. We need to work together to increase access, market stabilization, and minimize premium cost rises. We need to work with states that haven't expanded Medicaid to bring down premium costs for the self-insured. I stand ready to work with my colleagues to achieve these goals and protect the millions of Americans and thousands of Alabamians who are more financially secure today because of the protections of the ACA. I yield back the balance of my time.
The gentlewoman yields back.